My name is Jodi Lamanna, and I'm a research associate at UNSW Australia working on the Disability Matters project with Professor Jackie Leach Scully. The UNSW component of the Disability Matters project looks at the research question: what kinds of research methodologies represent people with disability and their health priorities? Just to note, in Australia, we often use person first language, which I realise is different in other countries. So when I say people with disability instead of disabled people, it is just because it is the preferred terminology used by government and in formal situations in Australia. However, many people with disability do prefer to use identity first language, so it is important to ask the person with disability what language they would prefer to be used. Going back to the research question, which looks at methodologies used to ask people with disability about their health priorities, our team conducted a scoping literature review about methods used to ask people with disability about health priorities. And the findings for the scoping literature review showed that it was rare that people with disability were actually asked about their health priorities in a research or health service situation. That is significant as key perspectives may be missed in research. This is also problematic from a human rights perspective, as it doesn't allow for individual autonomy and equality of opportunity that is advocated for in the United Nations Convention on the Rights of Persons with Disability. While the scoping literature review has given us a broad overview of health and disability, our project moves beyond what has already been written, and we will speak with key stakeholders about how people with disability are asked about health priorities. So, firstly, we will speak with people with disability and ask how they would like to be asked about their health priorities. We will also speak with disability advocates, families and carers, health professionals, and researchers and academics. And this will provide a comprehensive view of what is being asked and how it is being asked. And we will look at how this can be done better. We will conduct interviews and focus groups, ask questions through surveys, and we will facilitate online workshops. Toward the end of the project, we will compile evidence of best practice when asking people with disability about their health priorities. And this means that the information supplied by people with disability and other key stakeholders will be shared more widely with others who interact with people with disability in health settings. These findings will be shared in the most accessible formats possible. This includes having open access for academic articles so that the findings are not locked behind a paywall. It also includes having plain English and easy read versions of the findings. It is anticipated that some of the findings may be shared in creative ways as well, and that's something that we're looking into so that the information will be useful to a wide range of people and professions. To finish up with, I'd like to say that it is a privilege working on research that will have a direct impact for people with disability. Thanks for listening.